This is a reaction to a video called My Insane 2.5 Months on Finasteride, Minoxidil, and Dermaroller by Al Garrido. Let's take a look.
I've been taking 4 years straight finasteride to combat hair loss.
Okay, so it looks like he's been on 4 years worth of finasteride at 1 milligram is what it seems, but the video is called 2.5 months, so maybe he's added other medical therapies more recently. Let's see.
This was me before and 2 years after the treatment.
But you see in this photo, it's hard to compare, right? His hair color is different, the lighting is very different, the angle is different, and this comes up a lot for before and after photos related to hair transplants. It's very easy to show very impressive results when you have a change in the length of hair, the lighting conditions, angulation, all of that matters. So trying to keep that stable and consistent, I think, is a good goal. Also, there are some clinics that will put fiber into the hair for the after photo, so everything looks like super dense, and you'll see no bare scalp at all because there's a sheet of fiber there. So something to keep in mind when you're looking at before and after photos from different places.
You may think a pretty impressive success story. However, last summer I was experiencing a new massive shedding.
So in this photo at 13 seconds, it sure doesn't seem like he's lost a ton of ground, but I'm sure he knew that he was shedding. And so the question then becomes, is it that the finasteride was a generic type that wasn't effective anymore? Is it that there were other stressful events in his life, or just very accelerated male pattern loss that was going on? Unclear. So let's take a listen.
Especially around the temples. It was time to step up the game, so I added 3 more treatments, which were Minoxidil in topical form, Dermapen, and Nicerol shampoo.
And we've covered all of these different medical therapies on the channel. We have videos for all the different types of medical therapies, and often we're recommending at least dual modality medical therapy. So for example, finasteride and minoxidil, which we both prefer in oral form since that's the more potent version of them as opposed to topical. But he then went a step beyond and started doing microneedling essentially. We prefer a stamping type of tool as opposed to a roller. And then the Ketoconazole is fine. It's an antifungal treatment, usually several times a week, and that might help as well. So it looks like he was able to get ahead of the frontotemporal recession with the addition of those other medical therapies. The other thing to remember is that as you're doing all of these different things, it's hard to know which one is actually responsible for the benefits that you're seeing. Since, how do you control for all the different variables of all the different medical therapies? So that's why it's sometimes best to just start with 1 or 2 forms of medical therapy and then add if you need, as opposed to doing 5 different things all at the same time. We'll be offering medical treatments with generic drugs very soon, and that will include finasteride and minoxidil at lower prices than you can find pretty much anywhere else online. So sign up to signup.feelconfident.com to get the latest information about our product updates, so that when it becomes available, you can jump on and get the medications that are generic drugs at affordable prices.
Alright, so first I will briefly break down when and how I used these treatments. This is the way that best worked for me. What I did was the following. Every night I applied 1 milliliter of minoxidil to my hairline.
So it looks like he's using the solution form of minoxidil. Remember that it's also available in the foam form of it, and it's generally recommended as a twice a day type of application for men and usually once a day for women.
And I only did it to the area that was thinning. I never applied it to the rest of the scalp because once you expose the rest of the hair to minoxidil, it will be forever dependent.
So it's not that that hair becomes dependent per se, it's just that you're only seeing the improvements while you're consuming that agent, in this case minoxidil. And that's really the case from all medical therapy. So it doesn't matter so much if you're only putting it on the spot that's affected or more diffusely on the scalp. Most of the impact is actually because you get some degree of systemic absorption, and that is creating impact on the scalp hair. If you take minoxidil as a pill, then you have an even more potent type of response. And the reason there's some systemic effect, right, is because most people will experience some degree of increased facial growth on minoxidil, even if they're putting it on topically. So it doesn't just affect the area where you're placing it, since there's so many blood vessels in the head and neck, and you get that systemic absorption.
Discontinue using using minoxidil, you will lose all the hair that you regrew using minoxidil before. So I saw no reason of applying it to the rest of my scalp where the hair was okay so far. Also, I applied minoxidil once a day at night for a reason. Even though the companies will tell you that you should apply minoxidil twice a day, once in the morning and once in the evening, that's not strictly necessary. The product has a half-life of 23 hours, so even though you apply it just once a day, it will make no difference.
The recommended dose for topical minoxidil is twice a day, but the half-life is 22 hours. You do get pretty good results with once a day application as well.
But then I noticed that was pretty much inconvenient for me. Why? Because sometimes you just won't have the time to let it dry, or it will be difficult to fix your hair after that. Instead, I found out that it is much more convenient to apply it right before going to bed. I personally do it around 8 o'clock in the evening, but that's just my personal preference. I'm sure every one of you has their own routines. Alright, let's talk about the second treatment. Once a week I will also microneedle the hairline with a needle depth of 1.5 millimeters.
Once a week microneedling is frequent, and most people are advised to start at most once a month and then working up from there if they feel comfortable. We have a video on microneedling for hair restoration. Make sure to check out that one.
Before, I used to apply the minoxidil 24 hours after microneedling, but now I just do it right after. I have not experienced any side effects such as headaches, heart palpitations, etc., etc.
So he's describing some of the potential side effects of minoxidil, and that's good that he hasn't experienced them. Minoxidil often has a base of alcohol in it, the way that it's made and manufactured. And so when you're microneedling and applying minoxidil right away, some people will experience a burning type of sensation. And so usually it's advised to separate out the microneedling sessions from the application of minoxidil.
I have, however, noticed a side effect with the dermapen, which is simply flaky skin. This is pretty annoying, but I also feel it was worse in the first weeks of doing it.
Microneedling at a depth of 1.5 millimeters can increase the degree of scarring in the tissues over time. And when we do hair transplants, we can feel that rigidity of the tissue. The way that we place the grafts into the scalp, oftentimes we can sense that type of rigidity compared to a scalp that has not been microneedled frequently.
Now I feel the skin is much more resistant to it than before, and it doesn't flake so much as it used to do. This is, however, not a deal breaker for me because the skin just gets normal again after a few days. The reason I use a dermapen is because, well, first of all, you get much better precision when microneedling, but second, and this is also a very important point, is that you can exchange the derma stamps, and if you do that, you will have much less risk of getting an infection using microneedling.
Yeah, it's great when you have disposable cartridges, just like razor blades for shaving, that you can replace and use fresh ones. And of course, that will minimize infection, especially because you're usually generating some degree of pinpoint bleeding, at least in some areas when you're microneedling. So it's good to be able to exchange that frequently.
Treatment, which is simply the Ketoconazole shampoo. I use the Ketoconazole shampoo once a week. I could actually use it more often, but I find it is not strictly necessary. To be honest, I think the Ketoconazole shampoo helped, but it was not a deal breaker when it comes to regrowing new hair.
The situation for most people will say that the Ketoconazole, if anything, gives them a small degree of benefit. It's not one of the primary agents or one of the primary forms of medical therapy for hair restoration, but it can help in certain circumstances. And again, once a week is probably sufficient. We can go up to about 3, maybe 4 times a week, but typically that's not necessary. You don't want to be using it every day because it can really dry out the scalp.
It will help to regrow your hair a tiny bit, but not as much as finasteride or minoxidil. Where it helps, however, and it is still helping, is when it comes to the common itching of the scalp for those people that are experiencing a shedding or balding.
Well, yes, I mean, with seborrheic dermatitis, that's the primary kind of culprit that you're targeting with the ketoconazole and that itchy, flaky type of scalp. So with that, it can help. And if you let that condition go without any type of remedy, then you can potentially get additional hair loss. So that's where the ketoconazole is being effective to a degree.
In my opinion, the shampoo helped there a lot because it has some anti-inflammatory properties. But like I said, I would not use it actually more than once a week.
Well, the antifungal aspect of it and targeting some of the various funguses and yeasts that can live on the scalp is really where you're getting some degree of decreased inflammation. It's not the shampoo itself, but it's the fact that it's reducing that type of flora that lives on the scalp that can be increasing your inflammation. That's where it's improving the condition.
Because it is pretty expensive. This bottle, for example, costs $30 US. I would use it as a nice addition to getting that extra kick when it comes to regrowing your hair and also having an ease of mind. Okay, let's cut to the chase and see the results. So this picture is 1 day before starting the treatment.
Even at this point, he's been on finasteride for 4 years. You can see some frontotemporal recession there. He's essentially nearing a Norwood 2, going on closer to 3 at that point. So it seems like, you know, he's improved quite a bit. So we'll take a look here.
Huge loss of density and hair in the temple area. In the first 2 weeks, I would say that nothing happened. There was no shedding yet. The 4th week, however, there was a big shed. It may or may not be so noticeable in the picture, but...
And shedding will often scare people. They'll think that whatever they're doing is not effective because they're starting to shed. But in reality, it's actually the opposite that's usually true. It's because the hair cycle has been accelerated and we're pushing out some of the older hairs to make room for the newer hairs. That's the reason for the shed. So sticking it out with the therapy is usually the solution. And once the shedding corrects itself, then you will most often see an improvement in the actual hair thickness and overall appearance of fullness.
Besides that, I was finding so many hairs like in the shower, in my bed, and especially in the sink. Terrible, because that's a moment where you don't know if the treatment is working, so you're shedding before the regrowth, or you're actually just shedding because, I don't know, you are still balding.
He's right. Yeah, this guy's smart. I mean, he definitely he's right on the mark with that.
Surely after 3 more weeks, more or less, the shedding stopped and regrowth started. Not just the hair that I just
Good on him for being patient with the process.
shed, but also new hair that I had lost like 4 or 5 years ago. Hopefully you can appreciate it in this picture. I mean, all that hair was not there before, guys. And it's just a wonderful feeling to see that, and I think it does not stop there. Here's, by the way, a before and after picture that clarifies even more what a big change.
Yeah, that's definitely a nice improvement, and it's a reminder that you don't necessarily have to jump to hair transplant surgery right away. Many of my patients who come in for hair transplant surgery have a similar situation, and it looks to them like sometimes that's the only solution is surgery. And we talk about medical therapy, but you can see how motivated and consistent you need to be to get these types of results. And Al was, and many other people are not. But it's great that he was able to achieve these results with medical therapy alone.
Big change just happened in 2.5 months. I will continue posting my regrowth in this channel. And guys, just don't lose faith. Just hang in there. Until next time, I wish you a happy hair journey. Adios.
Happy hair journey to you all. Yeah, thank you for this video, Al. Thank you for sharing your experience. This helps the community at large with their hair journeys. And if you guys have any questions, please put them in the comments below and we'll address as many of them as we can.